It was day 2 for the CDC's advisory committee meeting on vaccine policies. Today, advisors tabled a vote on hepatitis B and will not be changing current recommendations. They also approved a new recommendation that says adults who want COVID vaccines must first consult with their doctor, but no prescription is required. Yesterday, advisors did approve changes to recommendations for the MMR-V vaccine for kids.
So for more on that, we bring in our 9 News medical expert, Dr. Payal Kohli. So we have so much to talk about, but let's start first with the MMR-V vaccine. What is it exactly, and were you surprised by this?
So it's different from the MMR vaccine. We're all familiar with that as parents. It's measles, mumps, rubella, given usually at 1 year and then again between 4 and 6 years. So a few years ago, they decided to add the V, which is the varicella, the chicken pox, to it. So now it's measles, mumps, rubella, and varicella, and they started giving it to kids, same dosing schedule. And what they noticed was there was a higher rate of febrile seizures. So little kids, especially the toddlers under the age of 2 or 4, were having more febrile seizures when getting the combination vaccine. So yesterday the advisors met and they voted 8-3. So it wasn't a unanimous decision. One person abstained to say, let's get rid of the V and separate it out. So we're getting MMR, which we've gotten for a long time at age 1 year plus 4 to 6. And then the varicella should be given separately.
When you talk about these seizures, is this like, 1 in 1,000? Like, how high is the risk?
Yep, so it's about double. So if the normal MMR vaccine, which are, by the way, live attenuated vaccines, which means they're weakened versions of the virus, they're live virus, it's about 4 out of 10,000 kids that will get a seizure. It's going to increase to 8 out of 10,000. So you think about if you start vaccinating people on a population level, even though the risk is small overall, out of every 2,300 to 2,600 kids, you're going to cause 1 extra febrile seizure. Now, the febrile seizure itself is not thought to be dangerous, we don't think, but toddlers are primed to have febrile seizures. That 1 to 2 year age group, their immune system loves to overreact to heat. And so when you put in so many different vaccines together, it's called immune synergy, immune activation synergy. It just kind of freaks out and it increases that risk of seizure.
Makes sense.
So for this new recommendation, is it controversial? How is the medical industry and doctors like yourself responding?
It's really controversial. And to be honest, I'm a little bit torn because one side of me, I'm an angel and a devil here. One side says, this is great because why increase risk, right? Even though the overall risk is small, it's not long-term damage, but it's scary for parents. It's not great to have a seizure. There can be complications from it. So let's just separate them. But we know that when we separate vaccines, compliance goes down, which means people are less likely to get them, which means they're more likely to get confused. You have to make more visits to the doctor. And especially for kids that are low income, this may actually mean that they're not covered, that they may not be able to access them.
What about hepatitis B for newborns?
Yep, so that's the one they shelved today, but I'm waiting with bated breath on this because if they say that newborns shouldn't get hepatitis B, I would be shocked and surprised, and I do think that that's going to increase the risk of hepatitis B. But what we're seeing really, ladies, is a trend away from kind of, this is our policy, the CDC is saying what we should do, to more kind of individualized decision making. So the CDC with this decision has not prohibited parents from choosing the MMR-V. It just says they're not recommending it. So insurance coverage might be an issue, but there's a federally funded vaccine program which over 50% of kids use to get free vaccines. That's offering the MMR-V. So if you as a parent decided, hey, I'm just going to accept that increased risk and just get it done, you can still go ahead and do that. But we're seeing the same sort of trends with COVID vaccines where more and more decision making is shifting to an individual. And I worry because without all the data, the facts, sometimes it's hard to make an informed decision as a parent. I'm not sure which one you guys would choose as parents, but
I rely on my physician.
And on the CDC to guide us.
I do. I take the time and the research to make sure I'm picking the right pediatrician, the right family doctor. Of course, I've always listened to, like when Dr. Fauci was giving all those recommendations back during 2020 and COVID. So yeah, I don't have enough experience personally to make those decisions, I feel.
And now doctors have sort of left with a choice. If it was my child, I would probably separate them, but it means parents have to take more responsibility for making sure that they get those doses done. Their kids aren't missing any. Because, chickenpox, varicella is a terrible disease because it causes shingles. It lives in your body forever once you get it. I wish I had had the vaccine because I had the bad chickenpox and a bad shingles after that. So,
Wow.
Yeah.
I do what my doctor say.
Yeah,
so,
same.
I know.
But we'll see what the hepatitis B shows. That's the one I'm really anxious about.
And we'll be talking about that, I'm sure. So Dr. Kohli, thank you. You can find more with Dr. Kohli at 9news.com/Dr. Kohli.